So there actually are really good alternatives to LASIK. Whether you're somebody that just wants to know your options, you might not be a good candidate for LASIK, or you just want to avoid some of the side effects from LASIK. These are all the top alternatives with their pros and cons. Let's focus in. So first, let's do a quick review of LASIK. LASIK stands for Laser Assisted In Situ Keratomycesis. And nowadays during the procedure, they actually use what's called a femtosecond laser to create a little flap. They actually cut the top surface of the cornea and actually peel the top 1/5 of the cornea back like a flap, almost like a hinge on a door. And then with the rest of the cornea exposed, they actually use an excimer laser and actually vaporize and carve and reshape the cornea to actually correct your prescription. Now once that laser is done, they actually can just put that flap right back over the cornea and let the cornea naturally heal. Now, the benefit to this is during the procedure, it is really quick, near painless, and the healing time can be near instantaneously, or within a few hours, people will be seeing 20/20, will be seeing the bottom of the chart. And this is why this has been the top refractive surgery option, just because it is so quick and painless, and the results speak for themselves. So obviously there are some limitations to this. If you have a really high prescription, they might not have enough room to actually make a flap and laser your prescription into your cornea. So you might not be a candidate based off either your high prescription, or you might be someone with a thin cornea. The first alternative we need to talk about has actually been around longer than LASIK, so likely you've heard of this. It's called PRK, or photorefractive keratectomy. Now with this procedure, instead of using a laser to create a flap, they actually use a solvent or a chemical to remove the top layer of the tissue of the cornea. And then they use that same excimer laser to vaporize, reshape, mold that cornea to correct your prescription. And then when the laser's done, they actually put a contact lens or a bandage contact lens over that cornea. And then over the next week to a few months, that cornea does re-heal and your vision does improve. Now with this one, and probably the reason why it's not nearly as popular as LASIK, is that the healing time definitely takes longer than LASIK. It usually takes over the next week, maybe to the next few months. And within that first week, it actually can be pretty irritating to the patient, can actually be painful, especially in those few days. Now, the benefit with PRK, if you are somebody that has a higher prescription or a thin cornea, then PRK may be an option because they are able to do that procedure on people with thinner corneas or higher prescriptions, because they're not having to use some of the corneal tissue or some of the thickness to create a flap to put it back. They just laser right off the top. And so that does save a little bit of working room for them, that they can actually correct a larger prescriptions or work with a thinner cornea. Another pro to PRK is because there isn't a flap that's created. There isn't the possibility that that flap might be reopened or moved or dislodged somehow in the future. Now that is actually pretty rare to happen to a patient that's had LASIK, but I have seen that in the clinic. Patient went hunting, tripped, fell into some bushes, bush twig hit the eye and pulled up the flap. Another pro with PRK, at least in the studies, patients usually don't have as many dry eye problems following PRK versus LASIK. The next alternative is called the smile eye surgery, or a lot of times doctors will refer to this as LASIK 2.0, or the improved LASIK. SMILE stands for small incision lenticule extraction. Now with this procedure, much similar to LASIK, they take that femtosecond laser, and instead of creating a flap like they do with LASIK, they actually go down deeper, a little deeper into the tissue, and actually vaporize or carve out a little disc or lens shape in the cornea. And then making a little 2 to 3 millimeter incision on the side of the cornea, they can actually go in there and actually remove that tissue or remove that lens or that disc that they created. And this actually corrects the vision. Also similar to LASIK, very fast procedure, virtually painless, and healing time is very, very short, with some people getting out of the procedure and seeing quite well within the first few hours. Additionally though, because of that cornea, a lot of the cornea is left intact. The structure is more natural compared to what happens after LASIK. That is beneficial in the long run, and one of the benefits is actually the reports of dryness after the procedure. People with SMILE still have reports of dryness, but it's nearly half of the reports of dryness with LASIK. Now, definitely some cons to this. Right now, Smile does really well for people that are nearsighted and have astigmatism, but people that are farsighted or have hyperopia, this is not an option, unfortunately. Now, if you're somebody that's looking to avoid any corneal surgery, laser onto the cornea, affecting the cornea any way, then these next two alternatives will be really great options. The first alternative is called an ICL eye surgery, and this one seems to be gaining more popularity and probably is becoming one of the bigger alternatives to LASIK. ICL stands for implantable collamer lens. A lot of people will say it's an implantable contact lens because that's really what it is. You're actually taking a little piece of plastic that looks like a contact lens, and instead of putting it on top of the cornea, you're actually doing a surgery where you actually implant it into the eye. And this actually is placed between the iris, so behind the color part of the eye, behind the iris, and in front of the crystalline lens, in that little tiny space in between. The thing that makes ICL appealing is that if you are somebody that has a much higher prescription, maybe you have higher nearsightedness and LASIK isn't an option, maybe your cornea is really thin and so you can't really touch the cornea, then ICL will be great because it can actually correct for higher amounts of nearsightedness. Another really big benefit is this is actually considered a reversible procedure, a reversible surgery. Not like LASIK, PRK, or Smile, where if you vaporize and restructure that cornea, you don't get that tissue back. It's gone. It's a permanent procedure. Now with ICL, because it's an implant that you put in there, if something goes wrong or maybe your prescription changes or for whatever reason they have to actually take that lens out, they can actually go in there and remove that lens or change that lens with a different lens. More pros for ICL is the reports of dryness is way less than compared to LASIK. Another pro, people with ICL have lower reports of higher order aberrations. Another fairly common thing with LASIK, usually at nighttime, people might get more glare or light diffusion, light scatter, and a lot of these are considered higher order aberrations, whereas people that get ICL, way less reports of these aberrations. Now, a few things to consider here with ICL. It's usually approved for people between 21 and 45 years old, whereas LASIK really is FDA approved for 18 years and older. A lot of times, we don't fully recommend for patients that are 45 years and older, but ICL does have that age range that we're looking at. Also, it is better and approved for people in prescriptions of -3 to -15. Usually that's that range. If you are somebody that has less nearsightedness, maybe you're a -2, 2 diopters, then ICL wouldn't be a good option for you. Also, ICL can be more expensive. There's more of a cost, especially with the lens implant that they're going to put in there during the procedure. And so, yeah, just consider that. ICL is probably more expensive. Healing time with the ICL is actually pretty fast, and usually people after the procedure are seeing great and feeling great. The other really good option is something called a refractive lens exchange. And this is pretty much the exact same procedure as a cataract extraction or cataract surgery. With this procedure, they actually go in and remove the natural lens, the natural crystalline lens of the eye, and take it out of the eye, and they leave behind the natural bag or the capsular bag behind. And then they actually implant a lens that's similar to an ICL or a contact lens, but this lens actually goes inside the capsular bag. This lens is called an IOL, or intraocular lens. Now, the nice thing about this procedure is there are different types of IOL lenses that are available to be implanted. This can correct for farsightedness, nearsightedness, astigmatism. They also have more premium lens that are considered multifocal lenses. They actually have zones of power that might correct or focus vision for distance, intermediate, and near. You might have a combination of both, and this is something that you can really discuss with your doctor, and knowing your goals of what type of vision and where you want your best focus to be, you can actually really customize your vision and try and set your vision a certain way that you want it to be. Now, an issue to consider is that crystalline lens, our natural lens in there, its main responsibility is not only to focus light, but to adjust focus. When we're looking at far, it will adjust. When we look at close up, it will adjust and flex, and that's what gives you that range of focus. You're able to adjust your focus with that lens. If you remove that lens out of there, then there's nothing to adjust. So if you put a normal IOL, a standard IOL, or a single vision focal IOL in there, meaning it's just focusing the vision for the distance, then you might find yourself having difficulty close up, meaning needing reading glasses because you kind of took away that natural focus that you had. Because of this, a lot of times refractive lens exchanges are more looked for patients that might be 40 or 45 and older. They might start entering what's called presbyopia. They're entering the stage where they're starting to need bifocals or reading glasses. That natural crystalline lens isn't focusing or doing the job as well as it used to. So then refractive lens exchange does become kind of a better option in that stage because we're kind of losing that ability anyway. One other pro is because you are removing that crystalline lens, that lens is the same place where cataracts happen. And that's why I said this procedure is pretty much the same as a cataract surgery. You replace that same lens. And so down the road, you're kind of eliminating the possibility that you'll get that type of cataract, or you might not need cataract surgery because, hey, you already had it. You got rid of that natural lens. Now, healing time with a refractive lens exchange can be a little bit longer compared to LASIK. You might be using a little bit drops, and for the first month, you might have a little bit fluctuating vision, and the cost for a refractive lens exchange is usually more expensive than LASIK, so keep that in mind as well. Now, statistically speaking, across the board, the outcomes for these procedures are usually great, usually considered excellent. Visual outcome for these procedures are going to be great, stability is great, longevity is great, and so really a lot of these procedures, a lot of patients that I see, people see great and are usually happy. Now, with any surgery, with any procedure, there are side effects and things that can happen, so definitely discuss with your doctor, look into it thoroughly, and make sure you get thoroughly checked and have thorough knowledge of every possibility and option that you might have. So that being said, if you want to learn more about LASIK, check out my playlist right here. If you're a good candidate, what to expect after LASIK can be very helpful. And like always, if you have any questions, leave them in the comments. I'll do my best to answer them. Stay focused.